Hi everyone, I'm Sean Duhamel from the Mass Retirees Association. Thanks for tuning in once again. Today's Friday, January 17th. I have some good news to share in our weekly update. If you receive your health insurance benefits from the state, from the Group Insurance Commission, so whether you're a state retiree, a state employee, or a retiree or an active employee from the 40 or so cities and towns that participate in the GIC, your copayments, your deductible, your health insurance plan design is not expected to change in 2021. That's fiscal year 2021, which of course starts on July 1st. Now, I'm not talking about insurance premiums. We'll get to that later. Those have not been determined yet. But yesterday, the State Group Insurance Commission met. They discussed their plan design options for the coming year, and they have made a preliminary recommendation not to increase copayments, deductibles, or any of the out-of-pocket costs that are, quite honestly, costing our members a lot of money month after month, day after day, year after year. It seems that every time you turn around, every time you go to the doctor or any kind of medical appointment, you're paying more and more out of your own pocket. But for the coming year, at least, those costs are not going to go up. Now, we still have a ways to go. As I mentioned a minute ago, the premiums for the current year, or for the coming year, the amount of money that you pay out of your pension check or your paycheck every pay period, those rates have not been determined yet. Now, part of the rate structure, of course, is the percentage that all of you have to pay for your insurance. Those percentages are set by the legislature in state law, in the statute. We don't anticipate any of those percentages changing for the coming year. Now, our association and all of the public employee unions together met with the GIC leadership and their health insurance consultants this past Wednesday. We were there for just about 2 hours. It was a really engaging, interesting conversation, and a lot of give and take. A lot of things were discussed. And I want to say thank you to the GIC and the GIC Commission, which is chaired by Valerie Sullivan, for your efforts to make the process more transparent, to bring in stakeholder groups like Mass Retirees and our friends at the AFL-CIO and all of the public employee unions to allow us to have a voice and a seat at the table and to at least talk about the types of things that are important to our members. Now, here at Mass Retirees, all of the health insurance benefits are very, very important. But no more important right now is the issue facing our non-Medicare retirees. And we continue to make strides going forward to find a solution to controlling costs for those retirees who are age 65 or older, but are not eligible for Medicare because you never worked under Social Security, you never paid Medicare taxes, and you're just not eligible. Now, we got some updated information. We always assumed, or by our calculation, there are some 30,000 or 34,000 retirees who are not eligible for Medicare. Well, the GIC has been going over their records, and it's been determined that the actual number of retirees who are not eligible for Medicare, and these are retirees age 65 and over who don't have 40 quarters and are not married to someone who has at least 40 quarters, so they're not eligible. That number is actually somewhere around 7,000 people. So it's not as high as we thought, which is a good thing, but 7,000 people is still a lot of folks that are suffering under the current plans. And the GIC is working on this. There is no immediate change that's going to take place, and we'll provide more information to you later on. But I know this is a hot topic for a lot of people, and I wanted to update you on that. But most importantly, for everybody under the GIC, there will be no increases in your copayments and deductibles for the coming year. Now, to throw caution into the wind, these types of changes and benefits are really set year by year by year. This coming July, we enter the third year of the current contract under the GIC. The GIC offers 11 different health insurance plans. Those are both Medicare and non-Medicare plans. All of those contracts are up in 2021. That being said, the GIC does have the option to extend those contracts for 2 more years beyond 2021. Under state law, the maximum length of a health insurance contract can only be 5 years. So we're entering year 3. There's a potential to extend the contract another 2 years, and we'll have to see what's going to happen. But there's no denying that the cost of healthcare continues to rise. There's only so much the GIC or anyone at this level can do to gain control over these costs. And whether the answers come from the federal government or the state government or a combination of the two, it's something that everyone continues to struggle with. And we are going to continue to work closely with the GIC, continue to work closely with our friends from organized labor. And again, I can't thank the AFL-CIO enough and President Steve Tolman for including our association with everything that labor is working on when it comes to healthcare, including us in meetings like that took place on Wednesday. We're not a union, but we're part of this brotherhood and sisterhood with all of the public employee unions, and I can't thank them all enough for including us in this very, very important process. So those of you who are retired from the local level, you might be saying, what does this have to do with me? I get my health insurance from the city of Boston or from the town of Plymouth. Well, here's what it has to do with you. As we've explained before, policies that are initiated and begin at the state level very quickly have a way of finding their way back home at the local level. Now, years ago, that could take a year, 2 years, 5 years maybe to come home to roost at the local level. Now we're seeing this happen in a matter of weeks or months. Sometimes within days of the state taking action, some board of selectmen out there is trying to follow suit to increase costs on their local retirees and their local employees. So we're all in this together. And where the state is holding the line and not increasing costs on people, that they feel for right now they've gone about as far as they can and should go, we're hoping that sends a message to local officials that they can't simply cost shift and put more and more costs onto the backs of their retirees. We hope that this draws a line in the sand in terms of those kinds of policies. But again, going forward in future years, we don't know what's going to happen, and that's why it's very important that we stay on top of these things, we stay vigilant, we stay at the table, we keep working with our partners in the legislature and our partners in the healthcare industry to find more and more ways to get these costs under control. But for today, I think we can all be thankful and happy of where we're at least going forward into 2021. Now, one last thing. If you do receive your insurance from the GIC is going to conduct what they're calling listening sessions. Those listening sessions begin this coming week. On Wednesday, January 22nd in Worcester, the GIC will be at Worcester State University. On Thursday, January 23rd, the GIC will be in the city of Brockton at Massasoit Community College. Tuesday, January 28th in Springfield. On Wednesday, January 29th, here in the city of Boston at the McCormick Building. Thursday, January 30th, up in Lawrence at the Public Library at the main branch. And finally, on Tuesday, February 4th, 2 days before the GIC votes on February 6th, they'll be down on the Cape in Barnstable at Barnstable High School. These listening sessions are designed to explain, first of all, what's going on for the coming year. What's driving all of this? Secondly, they're designed to solicit your opinions back. So if you are receiving your insurance from the GIC and you have a direct interest in learning firsthand what's going on, or you have something to say that you want the commission and the GIC staff to know about, go to one of these meetings. This information is on our website. It's also on the Group Insurance Commission's website. Or if you're not on the internet, which you are seeing this video right now, so of course you're on the internet, but push comes to shove, give our office a call and we can fill in the details. But again, thank you very much for your support of everything that we're doing. We'll be right back at you next Friday with the latest news and information of the things that are important to public retirees. Thank you so much.